Hi, my name is Ross Fargnoli. I'm currently an outpatient orthopedic physical therapist and the spine team leader for Good Shepherd Penn Partners Physical Therapy, which is the official therapy provider for Penn Medicine. I've been with the company for about 8 years now. I graduated from what was once University of the Sciences in 2015. And upon graduation, I completed an orthopedic residency at Good Shepherd Penn Partners. And soon after that, I completed a 2-year fellowship in orthopedic manual physical therapy through Regis University in 2020.
Hi, my name's Casey Herman. I graduated from University of Sciences, now St. Joe's DPT program in May of 2021. Upon graduating, I was accepted into UT Southwestern's cardiovascular and pulmonary physical therapy residency program down in Dallas, Texas, which I began in March of 2022. So in the interim, I worked as a staff acute care therapist at UT Southwestern, getting acclimated to that hospital setting and just kind of what my treating life would be as a therapist there. I was in their residency program for about a year. Upon completing that in March of 2023, I relocated back to the Philadelphia area and had my first baby. So that's what I've been doing mostly. But I will be starting work as a senior one physical therapist at Pennsylvania Hospital through Good Shepherd Penn Partners in September. In the meantime, I did pass my board certification as a cardiovascular and pulmonary clinical specialist, which has been great.
My name's Sean McGuire. I'm a 2018 graduate of University of Sciences / St. Joe's University. I graduated in 2018. That May, I joined the University of Delaware residency to pursue my certified clinical specialist in sports PT. I did that program from 2018 to 2019, and I've been in private practice, outpatient orthopedics since that time. I'm with a private outpatient orthopedic setting in Downingtown, Pennsylvania now.
So after graduating from physical therapy school, I was confident that I wanted to treat an orthopedic patient population. However, I wasn't very confident as a new grad in my clinical skills or my ability to manage the more complex patients on my own. And in PT school, I feel like I was really prepared to be more of a generalist so I could pass my boards, but I knew I wanted to be more of a specialist, specifically in orthopedics. And for me, residency training provided the opportunity to be surrounded by experts who were both qualified and willing to provide the specialized mentorship that I was looking for.
I have always been someone that loves learning. So when I knew what area of PT I wanted to go into, right about around my P2 year, I started researching about residency programs and reaching out to the faculty that were in that discipline. So after doing some research, I really discovered like residency is right for me. I knew it would be about a year and it kind of fit into what my life plan was at that point. So upon getting interviews and being accepted, it really just kind of fulfilled all the check marks that I wanted.
I knew a residency was going to be right for me. When I graduated, I felt very strong didactically. I felt very strong as far as what I was comfortable with, as far as sitting for the boards and passing the boards. I think clinically, I still felt like I could gain some more experience with some experienced clinicians around me. So I felt like in order for me to get the most out of my clinical skills, I think I felt like I needed a bit more just to build some confidence with my clinical skills in a little bit more of a controlled setting beyond even just the clinical rotations I had at school.
So I think the biggest benefit and the reason why most therapists pursue a residency is for the opportunity to improve their clinical skills and their clinical decision making, especially in a specialized area of practice. So for me, this was orthopedics, but there are a lot of different residencies out there, including neurology, sports, pediatrics. So depending on the area that you are most interested in, there's typically a residency out there that you can pursue. And with the improved clinical skills and decision-making, the biggest benefit to me was building my confidence as a clinician. So with a residency, you have that dedicated mentorship and guidance in the clinical setting, which helps with managing the more complex patients. Especially as a new grad, this can be one of the most challenging things as you enter your career. And with this improved confidence and improved clinical decision-making, you're also going to notice improved patient outcomes, and you're going to become more efficient in the clinic. Another benefit to the residency for me was the opportunity for networking. So you have an opportunity to meet other residents and mentors, which opens up opportunities to become involved in other post-professional career building opportunities, such as teaching, becoming involved in different Con Ed courses, and potentially research if that's where your interest is.
One of the best parts of residency is that structured mentorship time you get. So the way it was in my program is we had 4 hours each week of formal mentoring time. And that was just a great aspect to really get down to things that I needed to work on. You know, of course, in any job you're in, is there someone you can probably go to and ask questions? Of course there is, but to have that one-on-one structured time where it was just me and my mentor, I would go over the patients that I was struggling with, or, you know, hey, I've been seeing this patient for 2 weeks. I'm not seeing a lot of progress. What can we do to get them better? Was really helpful and really helped me develop some clinical decision-making skills that might take some clinicians years to get. And I really got in that 1 year intense time during my residency.
I think ultimately the biggest benefit I had from joining a residency program was the confidence in my clinical skills. I think just having that experience of having the ability to treat your own caseload, but also having sort of a dedicated team and a dedicated group of people helping to kind of guide and mentor those clinical skills was the biggest thing. So I think ultimately my biggest takeaway was my clinical confidence. There's a ton of experiences that I got through the residency that I wouldn't have had otherwise. But I think ultimately the most important thing to me was the confidence in my skills when I got into the clinic by myself.
So for me, completing a residency and the board specialty certification afterwards helped me climb the career ladder within my company more quickly than my peers with the same number of clinical years of experience. So most companies will offer either bonuses or opportunities to grow into leadership roles more quickly for therapists who have completed some type of post-professional education, such as a residency or a fellowship. A residency for me also opened up, as I mentioned before, a lot of opportunities to participate in teaching as an adjunct at University of the Sciences, and also as a participant and leader for different continuing education courses. It opened up opportunities for me to become involved in conference presentations and different research publications and presentations, which is something that I personally am interested in.
So one of the great things about being a graduate of a residency program is employers know that you took that time to really focus in on the area that you're working in. So I can honestly say that when I started looking for jobs, when I was trying to relocate back up to Philadelphia, there was not one employer that didn't reach out to me and ask for an interview, which, you know, you're in a competitive job market. So that is something really great that from the get-go, you show up on paper and they're automatically asking and reaching out to you. Another thing is I have continued my involvement with the APTA PA. So I am now the vice chair of the acute care SIG for that. And that was simply a matter of they posted that they needed someone to fulfill the position. And I said, hey, I'm relocating back up here. I just finished my residency program. I work in the acute care setting, and it really just makes you a really marketable person moving forward in your career.
I think being a graduate from a residency program has affected my career mostly from a personal standpoint. I think it's helped me be the strongest therapist that I can be in the clinic every day. I don't know if that has translated directly to salary increases or anything like that per se, but I can say from a clinical experience, I think it's made me a stronger clinician starting out, and what that looks like in the clinic is certainly um, seeing patients every day. It put me in line to mentor new students a little bit sooner than I probably would have otherwise. So it created some leadership opportunities in my first job out of school. I ended up being a mentor for a new graduate out of school just because I had a bit stronger clinical skill just from having that year of experience. I think it also opened other opportunities for me as far as just networking, and it created the position I'm in today as far as making those connections through the residency, um, creating new job opportunities that way.
So I think one of the most important things to demonstrate on your residency application is a commitment to one specialty area that you're applying to. So it can be a red flag for residency directors that are reviewing the application if they see that you've applied to different specialty areas such as orthopedic and, let's say, neuro residencies. So speaking with different residency directors, this is a flag because it shows that you aren't really sure what you want to do with your career and you're not really committed to one specialty area, which is very important for someone that's going into a specific residency. Another big thing that I think is important for students to consider is building your CV as a student to make sure that your application stands out from your competition, which oftentimes is other new grads or even therapists who have been in the field for a little bit longer. So becoming involved in different research opportunities as a student when completing your capstone project, and also participating in different continuing education courses as a student in the specialty area that you're interested in can help you stand out on your application. I think the last thing that's important to consider is seeking out strong letters of recommendation. So it's definitely helpful if during your clinical experience or even interacting with professors that you get a letter of recommendation from a therapist who has specialty training or has completed a residency and fellowship themselves, because they can support your commitment and your readiness to participate in post-professional learning based on their experience.
So similar to when you apply to college or even PT school, you really need to stand out on paper to even get yourself to that interview process. While I was a student, I was really involved in a lot of volunteer opportunities that came across. So I was a student observer to the APTA-PA's executive board. So that was one thing on there. I also was the Pennsylvania co-ambassador to the American Physical Therapy Association, and was a member of a task force through ACAP, which is the American Council of Academic Physical Therapy. So just within the PT world, I was doing extra little things to help make my resume stand out to them. In addition, what they really do want to see is wherever you're applying to residency. So mine was a cardiopulmonary one, which with a heavy emphasis on acute care. They want to see that my clinical rotations were in a similar type of setting. So I maintained a good relationship with my CIs. I worked really hard when I was a student there, so I could ensure that on the back end, I was getting a really solid letter of recommendation from those clinical instructors and also from faculty members as well. That's a really big part of kind of giving your application like a well-rounded bird's eye view of how you'll be as a resident in their program.
I think setting yourself apart in the residency application process is important, and I think the biggest thing for me was creating relationships with professors and people that sort of were in those residency circles. Ultimately, a lot of new grads are applying to these programs, and who goes a long way in that process as far as recommendations and things like that. I think the other big thing that was super helpful for me was, not only recognizing what the residency could do for you, but also recognizing, doing your research on the programs and recognizing what experiences the residency can offer that interest you, and what, experiences that the residency can offer that align with your interests, and your ultimately your professional goals also.
So the program I completed consisted of a total of 45 hours a week. So 35 hours of dedicated clinical care and 10 hours of dedicated residency time. The dedicated residency time was spent mostly practicing manual therapy skills with mentors, shadowing mentors as they managed patients, and also co-treating patients that were more complex with the guidance of a mentor. Every residency program also has a didactic portion. So the program that I was involved in involved mostly watching pre-recorded lectures and attending live lectures that were delivered by mentors, and also discussing assigned articles that were assigned for each week.
So on a typical work week, I would see patients 4 days a week for a minimum of 32 hours. I had one designated day a week that was my residency day, which would encompass different things throughout the year. So I would either be doing my academic modules, which were on, I was on a pace that I could handle on my own. It was kind of like a recorded lecture, if you want to say. And then I would either observe surgeries, or I'd round with different teams, just different things that gave me background information on the patient population that I was seeing. I had 4 hours of structured mentoring time a week, because you have to hit certain hour requirements to graduate from an accredited residency program. There were some hours that I would just have a 40-hour work week. There were some weeks that I would be 50 to 60 hours I was putting in. However, I never felt like I was only ever doing residency. I did feel like I could have a pretty well-rounded work life. I was pregnant the last 6 months of my residency and didn't feel completely run down. I was tired, but I could still get things I needed done. And I was studying for my specialist exam on top of finishing residency. So it is a lot. It's a big commitment, but it is something that is very doable.
Work-life balance in residency was a bit different than working in the typical outpatient setting. There were dedicated clinical hours per week, but there were also other responsibilities and opportunities mixed into that. So a typical day might look a bit different. The morning you might have a little bit of admin time where you kind of get caught up on notes or research or things that you're working on at that point. Typically, over the course of the week, you would be seeing patients for 20 to 25 hours total. Um, Outside of that clinic time, you would have you would have instances where you might have physician shadowing hours in the morning, or in our case, sports residency, having some on-field shadowing in the afternoon. So the day could get a little bit longer than a typical outpatient setting, but that was typically balanced with some admin time and some catch-up time on the front end of the back end. So typically, a normal day might be expected to be 8 or 8:30 in the morning until, depending on when your, high school sport or your college sport experience ended, maybe 3:30 to 4:30 in the afternoon. Some evenings experiences, which is typical in outpatient orthopedics also. So overall, I'd say it was maybe a bit more than a typical 40-hour week that I have now in outpatient setting, but with some of those experiences that you're going there specifically for, which was always rewarding.
So when I was looking into different residencies, the location was important to me. So most of the residencies I applied to were within the Philadelphia area. The good thing is that there are a lot of hybrid university-based residencies now that allow for a bit more flexibility and can be completed remotely. So the residency I completed was all in person. However, there's other programs that are more asynchronous, self-guided learning models where you can complete them remotely and then attend weekend intensives and seek out mentorship on your own. I also had to consider the financial burden of completing a residency. So Good Shepherd Penn Partners residency was my top choice because for this program, they hire you on as a full-time paid employee with all the benefits that a full-time employee would have, with no additional fee associated with completing the program. The only catch to that was they require you to stay with the company for an additional year after completing the program. But for me, I saw this as a benefit because I wanted to be part of a hospital-based system such as Penn, and I could see myself staying employed with this company and growing within the company like I have.
So depending on what specialty you choose can kind of guide where you want to go. So cardiopulm is different in that there are not that many programs in the country. At the time I was applying, there were only 8 accredited programs. So I knew I was going to have to relocate because there are not any in this immediate geographical area. So I was looking at pockets where I wanted to live. I am not a super cold weather person, so that took a bunch off my list from the get-go. Another thing was I very much like the acute care setting, so I wanted to choose a program that had more of my time being spent on the acute care side versus the outpatient side. So that was a big part of that as well. I also know that eventually I do want to transition into academia. So a program that had a teaching aspect to it was also something I really wanted incorporated into where I ultimately went to complete my residency.
I think when I was applying to residencies, certainly one of the biggest driving factors for me was geographical location as far as proximity to the Philadelphia area. Luckily, in the Philadelphia area, there's quite a few of those programs. So I think that was one of the biggest factors. I think ultimately, sort of my driving desire to do a residency had to do more with getting the experience and getting the opportunity to be in one. So I did branch out from a geographical location just to kind of widen my net as far as opportunities to get one. I think ultimately now, the amount of programs and the amount of different private practices that offer those programs as far as being a full-time employee is also a great benefit now. So there's definitely plenty of opportunities, not just in the university route or not just in the hospital route, to get those experiences and get them as part of a larger team.
So with hospital-based residency programs, they oftentimes will offer more opportunities for physician shadowing. So this was built into the program that I completed, both shadowing physicians in the clinic and also during surgery, which I thought was really interesting. At GSPP, residents are also involved in teaching as preceptors for Penn medical students, where the physical therapist and residents run an orthopedic lab for third-year Penn medical students, which I thought was a really great opportunity to interact with physicians, both teaching and also for networking. Many of the mentors at Good Shepherd Penn Partners are also involved in different research projects themselves. So depending on your clinical interest, there are oftentimes a lot of opportunities available to become involved in research, especially when part of a larger university-based hospital system such as Penn Medicine.
So there were teaching requirements when I was a resident. However, that looks different from resident to resident, depending on what your ultimate goals in your career are. I, had spoken to my director and she gave me additional teaching opportunities because that was something I wanted to practice and wanted to get feedback on in a lab component or lectures, whatever I was giving. Same with research. So I participated in a small quality improvement project while I was a resident. Some other residents have gone on to do huge hospital-wide projects. That wasn't necessarily something I was interested in. So we spent more of my residency tailored to the teaching aspect versus versus research. So that was something nice. Is yes, there were requirements, but it could very much be tailored to what my interests were moving forward.
So I think some of the additional opportunities were one of the things that I enjoyed most about the residency is it really gave you a lot of opportunities to do a lot of different things that you may not get in a first year working experience. A lot of things that were specific to my residency program were some on-field and sport-specific observation and on-field management of injuries and things like that. I think the other big experience for me that made a difference was a lot of physician interaction, a lot of physician experience. That was broken up in the office. That was broken up during surgeries. That was broken up during kind of some on-field coverage things also, and just getting to see the medical side of things from their view, really puts into perspective from physical therapy side of things, how things work and how things are managed. I think the other big piece for me that I would not have had an opportunity to do is get into teaching a bit, and that was a big one for me. Getting the opportunity to be a teaching assistant in musculoskeletal classes, and getting the opportunity to be a clinical instructor for students was really something that sort of springboarded the first couple years of my career and really kind of gave me the confidence to take on some of those responsibilities in my first job, which can also set you apart when you get into that first role, is being willing and being a positive influence on students and new grads as well.
Yes, I did reach out to faculty, and I think reaching out to the residency director and talking to previous residents is very important. I also highly recommend shadowing a current resident or one of the mentors so you can get a feel for the environment, and also you can introduce yourself to the staff. This is going to help you stand out from other applicants who didn't do this, and it's also going to show the residency staff that you're interested in the program, and you can ask questions and see if it's the right fit for you.
So upon kind of narrowing down what programs I wanted to go to, I did send emails just asking about their program and some of the highlights of it. They will give you most of the time on your interview day or beforehand, like a small pamphlet or whatever it may be. But something that I always recommend is reaching out to the current resident or a past one. That's something that most programs always offer for you, anyways, just because they can give you a really good idea of what your day to day looks like. Hey, I'm moving here. Where should I be looking for an apartment? Hey, you're going to get a reduced salary most of the time. How are you managing your budget? Just those sort of things that maybe the director hasn't lived through that in their own program, so they're not necessarily aware of. But talking to that current resident or someone who has pretty soon graduated from that is a really vital resource, I think, in ultimately deciding, is this program going to be the right fit for me?
I did not reach out to the program or to past residents, but it is something hindsight being 2020, I would recommend. And I think using your network of professors that have relationships with those programs would go a long way in setting yourself apart in some of those application processes.
As I mentioned, one of the benefits to the residency I completed is that you're hired on as a full-time employee with full pay, with just a commitment to stay with the company. But unfortunately, this is not usually what happens. This is pretty rare. Um, in my experience, most hospital-based residencies will hire on the resident with partial pay to cover the cost of the program. Most of the private practice or hybrid university-based programs are almost always going to require a fee to complete the program. But I know with student loans, there's a way to defer the loans while in an educational program. So that's also something to consider.
So my situation might be a little different from others in that when I started my residency program, I was married. So I always had my husband's salary to kind of offset what I wasn't making. However, a lot of the other residents, so where I went, they had a neuro residency, a sports and orthopedic residency. Most of them were single, living on their own, whatever the case may be. So I made 80% of what a starting salary would be from a new grad physical therapist. And while when you're coming out of school, that sounds daunting and you're going to say, how can I do this? What I was telling myself was, I just went 3 years with making no income. So even a little bit of income, I should be able to make this work. Something you just need to look at is, I'm picking my rent. If you're, relocating and you're not near family, you can maybe live with. And then just kind of budgeting. Like I said, a year sounds like a long time, but I was so busy that I wasn't necessarily going out to eat or going to do all those things. So you just need to really lay out what that year might look like for you, and it is very manageable.
I think finances and managing finances is always the question I get when people ask me about my residency experience. The way I looked at it is going into it being a new grad from physical therapy school, I looked at it as an extension of that experience. Different programs offer different opportunities. Our program was a partial pay plan with full benefits and things like that. But if you look at the experience that you gained through that, if you look at it as a 1 year extension of school, and you look at it from the value of the experience you're getting, I think that goes a long way. I think also looking back on all the things that I've gotten involved in since then, as far as taking students and getting the opportunity to be a teaching assistant at St. Joe's, and getting some opportunities that I wouldn't have had otherwise. I think those opportunities outweighed, the 1 year of having to manage things a bit more. I think ultimately too, going from being a third year PT student to any paycheck is a good thing.
Residency might not be for everybody. I think one of the best things to help you decide if you should or shouldn't do a residency program is, do you really know what area of physical therapy you want to go into? If you're one of those students that you're like, I like peds, I kind of like sports, I'm interested in neuro, go out and practice for a little bit. There's no shame in working a year or two, really figuring out what you want to do, and then going back and doing a residency. There are plenty of people that are not new grads right out of PT school going and doing these residency programs. So take your time, figure out what you want to do before you commit to studying one area, one patient population.
I think in general, my biggest takeaway from residency, I knew that musculoskeletal kind of orthopedic world is the route that I wanted to go into, and I think graduating from PT school, you feel really really strong in your ability to take the boards and kind of be a general practitioner, which is great. I think for me, knowing that I wanted to go the orthopedic musculoskeletal route, a residency for me really just allowed me to hone in on that experience specifically. You hear a lot of different things as far as the experience you get and the years of experience you get. I do believe that doing the residency for a year, that one intense year does make up for a lot of kind of finding your way those first couple of years out of school, which can be overwhelming, as a new grad, certainly in a new job and a new field and things like that. So my biggest takeaway would be, go into it with open mind. If you have an interest, then it's certainly worth pursuing, and know that it's something that's a lot of times is there in opportunities that doesn't have to be right away, but it is a good opportunity to pursue if you're on the fence.